Okay, so got Dan face down now. So I'm going to do some thoracic mobs. Actually, mate, can you just lift a little bit more? I'm just going to pop that under just a fraction more. There we go. Down. That's better. Okay, so doing these three, you may have seen this before. I'm not sure if I've put it on. Anyway, this is a thoracic mob sort of technique. Now I'm going to do this first. Normally when I get people face down, I'll obviously have a bit of a feel through their spine anyway, which I sort of did with Dan before when he was sitting up. But at the same time, I want to sort of just get a bit of an idea of how much mobility he's got through his thoracic. So I'm just concentrating on the left-hand side because that was the one that he was sort of a bit restricted to. So I want to try and improve that as much as I can just by doing these mobilizations. So I'm going to start down low. So we're sort of almost at L1. All right, that's the junction. So I'm going to come up, hands go over the top of each other, and it's just some really slow PAs, posterior to anterior mobs. Is that comfortable, Dan? You let me know if it's not. The reason I've got the pillow there is obviously to give him some support, but also means I can get some extra movement through there as well. If you didn't have the pillow, then it'd be really difficult to get the spring there as well. And we've obviously got a little bit of rotation with the pillow underneath as well. So I just work my way up. It's not difficult. I'm not doing a high velocity thrust. Okay, so there's no manips involved in this. If there is a crack, it'll be not because of me. It will just be a simple gaseous exchange. So up sort of into scapular area here, just work my way up and then come back down and start it all over again. So I normally do this about 3 or 4 times. Okay, not rocket science as you can see, but it makes a massive difference. I was shown this technique by a physio colleague of mine when I was at the Com Games, and it works an absolute treat. So really important to have when we're talking about people with shoulder dysfunction. This is a great technique. I'd always do this because thoracic rotation is really important for shoulders, especially with your throwing athletes. So you're just using your body weight. I'm not pushing with my shoulders as well. It's just all body weight. Okay, and we'll do one more sweep. And then what we'll do, Dan, we'll get you up and we'll just get you to go through to rotation again, mate. I just stiffen this mid. Still with us? Yep. Good. Still no pain? No. Good. Right. Beautiful. Okay, mate. Let's get you back up. All right. And look, once we offload those lateral flexors, that'll make a difference too. But let's just see how you go with your rotation. So, yep, round to the left first for us, buddy. Yep, good. Round to the right. Round to the left again. How does that feel?
Much different on the left.
Yeah, yeah. And go round to the right.
The right, bro.
Yep, I know. Righto. Okay, on your back, buddy. All right. So now we're going to have a look at his wonderful lateral flexors and his rotators. Could have shaved for me, mate. Oh, you sort of shaved
Sort of.
down,
Yeah.
didn't you?
Yeah.
Did you think we were doing abdomen work?
No,
did
I
you?
ran out of battery.
Ah, the joys of clinic. Right. Okay. So Dan is definitely tight in these scalenes. We know this first rib's high. There's no massive surprise in that. I mean, obviously, I was on the table. I got Dan to have a feel of mine as well, and I'm exactly the same as him. And it's because I do a lot of loading through that right-hand side, and inevitably, you're going to put a lot of pressure on here. So tonally, you're always going to be really tight on this side, which, as you know, can be the starting point for peripheral nerve entrapment. But Dan doesn't have that, which is great. We're using the original, Premax original. Give them a plug. So the original is the, the tacky one. We don't need that much. All right, just need a little bit through there. Some general sweeps through there. So you can see his SCM right here. So I'm going right underneath that SCM. That's where those scalenes are. Scalene. So you'll notice I'll work it with a bit of passive range. So I'm going to work down as I go into rotation. Okay, so I'm not lengthening it. I'm actually trying to shorten it as I'm working. Is that comfortable, Dan?
Yeah.
Just like let me know, mate. Don't be biting your tongue.
What do you find when clients start rotating for you? So how do you then
great question, mate.
Get into this?
Yep. Okay, so let's say it's the first time someone's had work in this area here, so I'll spend a lot of time just doing this with no movement first, and then I'll just introduce a little bit of movement, and then try and work from there. It's like, you're right, because and not only that, people will guard as well, so once again, like if you're going in too deep, they're gonna guard up against you, and the head won't move. So like you're pretty used to it, your head moves really.
But what you want to try and do is minimize them contraction.
Correct. Yeah. And that's the art of what we do, Dan, isn't it? Is getting them comfortable and being able to work with tissue. So yeah, no, it's a good point. And then, obviously every now and then, if they're really red hot in here, the pressure, it's only minimal, what I mean? So you can only press into about there, and they're fiery as hell. They'll get the chest, they'll get into scap, they'll get it out their shoulder. Sometimes they get it all the way down their arm. So yeah, just got to gauge that pressure. So I'm working all the way down, almost right to his first rib. Okay, so that's where I want to get right down to that first rib area. So working all the way down there. And I just find working it this way, it just relaxes easy. I can get into the tissue a little bit more. Just do a little cross fibers just on the attachment there. All right, and then I'll work out a little bit further, hit that posterior scalene, which attaches to the second rib. Yeah. Oh, the stories this scalenes could tell, mate. How many massages do you reckon you've done in your career, Dan?
Jesus.
I tried to count it. Up once.
Did you?
Oh yeah. Andrew Curry, colleague of mine, asked me, try and work out how many massages you've done. Right, I'm working 5 days a week for the last, I don't know, let's say 20, 25 years. I've been working 35 years. Let's say I average out, say, 10 clients a day. Yeah, you start doing the numbers, it starts getting scary. Try and work it out, Dan.
My head's already hurting.
Yeah. All right, that's good. All right, so now I'm going to come around just to the back of your levator scapulae. All right, so it sort of sits about here. So I'm going to stick this hand under his occipital. Sink in here. Use my thumb in here, and then I'm just going to rotate and pin it at the attachment.
Where's upper trapezius in relation to your thumb here?
It's so the upper trap is here,
Yep.
and your mid trap's here.
Yep.
I'm pushing through it.
Yep.
I can try and push your trap out of the way, but you'll see what will happen if I do.
Yeah.
It just flick over.
Yeah.
So you're right. What I've got to do is go through the trap to get to the levator scap. But I'm going to do some work on your trap, and your splenius muscles as well.
Yeah, good.
Yeah, you'll feel like a new therapist. Right, okay, so that's what we're going to do now. So we're going to do some passive release techniques. And so this technique I do for anyone that comes in with TMJ, obviously neck issues, muscle tension, headaches, whatever the case. So it's a passive release technique, but I use it to sort of challenge the range of movement. So we're going to go into rotation first. Okay, so I'm going to come all the way down here, just using my fingertips, almost down to that C7 area there. Come up and then rotate through. And I'm going to take it all the way up, just short of the suboccipitals, like so. So we're just challenging that tissue all the way up. Is that comfortable?
Yeah.
And there's a little bit of traction on it as well. You probably feel.
Yeah.
Dan? Yeah, you can tell you get lots of massage. Dan?
Yeah.
Yeah, all the way up. Right, now I'm going to do a bit of lateral flexion. Same again, but I'm just using lateral flexion now. And then a little bit of lateral flexion and rotation. So lateral flexion and then rotation. So you just want to sort of try and challenge that range as much as we can. Yep. That's good. Terrific. Right. A little bit of SCM while we're here, because we know that's a main rotator. So I'm just working the lower half. How you going with that, Dan? I know you probably want to cough, but
That's right. No, it's still all right now.
so trick for SCM, don't squeeze it. Okay, you sort of almost got to pick it up and just glide along it. Okay, so that's the bottom half, and then we're going to hit the top half. You can see you've got a massive SCM.
Disagreeing, I do.
Right? Good. Not with me.
No.
No. So I'm working the posterior part and the upper part of SCM now. So I'm just picking it up and rotating through there. So once again, there's an art to working SCM, because if I grip it hard like that, yeah, that goes straight to your head, doesn't it?
Yeah, for sure.
And it's uncomfortable. And so he's just going to contract and it'll slip out, and there's nothing worse than slipping off SCM. That's a horrific feeling, that. So you've got to be comfortable and just let your fingers do the work. So you'll find what I'm doing here, it's more of actually just a lifting technique more than anything. Like so. Beautiful. Okay, great. Now, of course, I would do the same on the other side, but for time's sake, that's basically I'm targeting this area here. Now, what I'm going to do now, Dan, is I'm going to do a little bit of just mobilizing on your first rib. So I'm going to sink down here. You're all right, mate. Thanks. Hand goes, thumb comes over the top of that first rib, and then this one's going to come over the top of it as well. Okay, so I'm just going to sink down to the first point of resistance, which is about there. That okay, mate? Yeah. All right, what I want you to do is just take a deep breath for us. So he's going to pop out and then let it all out. And then I'm going to sink in and just hold it there for about 10 seconds. 1, 2, 3, 4, 5, 6, 7, 10. Relax, come out. And then you're going to do that again. That's it all the way. Good. 1, 2, 3, 4. And look, sometimes people might get a little bit of referral down their arm, whatever the case, but normally, if your pressure's right on that C1, okay, not C1, sorry, first rib and go again. And then down. Yep. Good. So just 3 times, more than enough. And then I'll slowly come out. Good. Come over the top, just check where we're at. Yeah, that's much better already. Have a feel of your subclavius. Your subclavius was actually okay, because sometimes you'll notice when it gets hot, like it'll be. Yeah, no, that's good. Yep, that's good. Okay, and I know your shoulder's okay, which is good because you've got abduction, flexions all pretty good. So I'm pretty happy with that. So, yeah, right. So I'm pretty happy with that. Let's stop there. We'll get you to